Hi, everybody. Thank you all very, very much for being here. My friends at SBH were making fun of me that today is my SBH wedding day, which is probably true, except on my wedding day I was not this nervous at all. I just want to first start off saying thank you to the Haddad family, Nellie and David Haddad. I know we had a last-minute crazy change, but they really were willing to open up their home to us, and we're very appreciative. Also, obviously, thank you to Lawrence Avenue Shul for this craziness today, but God willing, it all worked out for the best, and it's really amazing to see you all here. To my co-chairs, Michelle Sasson and Gladys Hazen, love you very much. Katie Harari, and all of our friends at Karen Geffen Fertility Organization in Jerusalem. For those who don't know, we have collaborated with Geffen Fertility Organization. They are an established fertility center based out of Jerusalem that helps women dealing with infertility in a number of ways. And we are going to be collaborating with them. If you came to the yoga class this morning, it's one of our services I'll just be discussing. And we also had a training, which I'll get to also. To Doris Cohen and Susie Nagar for really pushing this program to happen. And also to all of the amazing, I said women around the table, but also men around the table who really helped establish this program. We started a year ago, and we've come a long, long way. They have been inspiring, amazing, really pushing this program forward to make sure it is at an excellence that only SBH can do, thank God. For those who don't know a lot about SBH, we were built to meet the needs of the community. This absolutely we felt was a need, and seeing you all here, I'm sure of it. Those women around the table really all felt similarly that they needed a place to turn to in their times of struggle. And one such woman around the table was Jacqueline Asher. She actually a year ago this week was in my home. We were getting ready to brainstorm for a program that would eventually lead to something like today. She was a bright light, and it was really devastating to lose her. And I remember going to visit Jeffrey during the Shiva, and I introduced myself. I didn't know him at the time. He knew me, I don't know how. And I said, Jacqueline was helping us with this, and we really were so inspired by her. I was so in awe of her. And he said, she would have gotten it done for you. And I told him, now we're going to get it done for her. So we always have her in mind. So just going back to those women around the table, like I said, they were all feeling alone, isolated, ashamed, confused, sad, and anxious. And we really built this program to meet those needs and to be able to come together. That's our new tagline, together we can address the needs of the women and couples of the community dealing with infertility, miscarriage and loss, and postpartum depression, anxiety. We're going to be doing so in a variety of ways. We have a number of supportive services in place today, and God willing, hope to expand and grow as the needs come. I can't imagine we'll ever turn a need or a person away. First and foremost, we're going to be having a peer-to-peer support program. 2 days ago in SBH, we trained 20 women who are ready and willing to be matched with somebody who's currently dealing with a struggle, to provide emotional support and to be able to assess their needs and meet those needs as needed. It's based on the famous SBH client captain model, which has been so successful for decades. So we have a lot of foundation to stand on. We're also, a couple of weeks ago now, we did a training with Geffen Fertility Organization. Their social workers came down from Israel. We're going on for a long time, guys. Came down to our counseling center at SBH in Brooklyn. We did a 3-day intensive training to understand the needs of women dealing with fertility challenges, and also they have very specific modalities that are used, CBT and mind-body, and understanding that when you reduce the stress and anxiety of women who are trying to conceive, there's a 30% increased chance of conception. It's wild, guys, 30%. Talk to any doctor, 30% is not a normal number. So we're gonna be offering support groups, highly, highly, highly recommended. I can only wish that I had gone to one at the time. And also one-on-one support through our counseling center. We also are gonna be offering yoga workshops. If anybody was able to be there this morning, it was amazing. Again, going back to connecting to your body, being able to reduce that stress and anxiety. We're gonna be offering a number of educational resources, events like today, but also newsletter, podcasts, anything that could help us break the stigma and raise awareness for these important issues. We'll also be able to connect you to other outside organizations who are already doing an amazing job at what they do, understanding what they can offer and connecting you appropriately. And then throughout the journey, as needed, we can, like I said, whatever you need, we can make meal plans, care packages, outings, whatever we feel can help release some of the burden. We're very, very lucky to have Dr. Robbie Sian here today. I was talking to his cousin last night, and I said, we got him before he became famous. Like this is our time. So we're very lucky to be having here. Robbie's actually dedicated his life to curing infertility. I know that's like amazing. He's also struggled himself, which he'll discuss, and I mean, he's got the full package, so very, very lucky. And to all the panelists here who have lived through one or all of these issues and have gained and grown tremendously from their experiences, I'm in awe of them. Each of them brings something so unique to the table. I can't wait to hear from them again. You're so lucky, guys. Okay, 2 things. Please no pictures or videos from this point forward. Just to respect the privacy of the panelists. Appreciate if no social media, nothing. Okay, I know some of your friends and family up here. We're recording it, we're taking our own pictures. We'll take care of it. And lastly, if you have any questions for the panel, we have an anonymous line here. You could text in your questions to this number, and we'll try and get to as many as we can. So without further ado, I'm gonna turn it over to Robbie.
Thank you so much, Rachel. I actually want to acknowledge, for those of you who were here earlier, what Katie Harari was talking, she was speaking about being a foster mother for a lot of people, and I was lucky enough to be a temporary foster child of hers when I spent a year in Israel. So thank you for that. All right, so welcome everyone. Thank you so much for coming out to support this exciting new initiative with Sephardi Pikuach Olim. I'm Dr. Robbie Sian, and I'm going to be moderating the panel discussion here this morning. And just want to kind of briefly give you a little bit of my backstory just to kind of understand why I'm up here with you today. So when I was in medical school, my wife Marielle and I, we decided that we wanted to start building our family. And much like we're going to hear about today, it turned out to be not as easy as we thought. And we had found out that my wife had diminished ovarian reserve, which essentially means that she had an extremely low number of eggs, something that you normally would see around the time of menopause. And we were given a less than 5% chance of ever having a baby, even with the most aggressive treatment that could be offered. And she was only 26 at the time. So we went straight ahead, went for most aggressive treatments, highest doses, multiple daily injections, ultrasounds, blood draws every day. And we failed and failed again and failed again. And we're told by 2 different doctors that we should proceed to donor egg. We weren't ready for that, kept trying, After our 6th cycle of IVF, we were lucky enough to get pregnant with my oldest son. And when we wanted to have another child, it took us 7 more cycles. And after years and years, which is kind of unfolds over the course of several years, ended up with twins that are about 1.5 years now, which is really, really nice. When I saw the heartbeat for my oldest son, after all those years of trying and after all the failures and the negatives, the ups and downs, and sort of the emotional roller coaster that we had been on together, that's when I pivoted my career and decided to become a fertility specialist so that I could help other people reach that moment that we had come to at that point. And so, completed 4 years of OBGYN residency, and now I'm in my last year of fellowship training, which is subspecialty training for fertility. And now I get to spend my days interacting with couples that are sitting right where we were sitting just a short time before that. So that's kind of the context for why I'm here right now. And now you're all going to have a really, truly unique opportunity to hear from our panelists about their experience in different aspects of women's health, from the days and months prior to conceiving all the way to the postpartum period. And I just want to note that it takes a tremendous, tremendous amount of courage for all these people to be up here today and sort of lay out their life in front of a crowd. So I just want to acknowledge that as well. And then again, just as a reminder, if questions come up, as things come up, just text it to the line. It'll be anonymous, and we'll come to those at the end. And so our first panelist is going to be Louisa.
I just wanted to thank everyone who had the courage to come out here today. No matter what you're going through, that's, to me, amazing. My name is Louisa Hannon, and I am 37 years old. Thank God my husband and I have an amazing family of 3 boys and 2 girls. We did not get here the conventional way, but I do want to share some of my journey with all of you. I was 21 years old at the time and married for a year when we decided we wanted to start a family. I had always had irregular periods, and I knew it could potentially be an issue for the future, but never really thought much of it. After about 8 months of failed attempts, I thought something might be wrong, but I was scared to talk to my parents or my in-laws for fear of worrying everyone. There was only one friend that I was comfortable enough to speak to, and she was not married, although she was always there for me to listen to and support me in every single step of the way. It was very hard for her to give me any kind of advice because she wasn't experienced. I decided to call my childhood pediatrician and run things by her. She told me that there should be no reason that it's taking this long and suggested that we see a specialist. I stalled, partially because I was scared and more so because I was still in denial that we really could be having a serious problem. Around that time, I overheard someone in a casual conversation mention a doctor that had helped her get pregnant. We went to him blindly without researching what his specialty was. After a brief conversation with him, he put me on Clomid, which was not the correct treatment for me. We wasted another 3 to 4 months of our time and our finances. At this point, I had become completely withdrawn from friends. It was just... It became harder and harder to hold on to any kind of relationships. Friends were either having children or getting pregnant or giving birth. Hearing other people's good news only caused me to sit home. No, I'm good. Yeah. Only caused me to sit home and cry. It was just easier to shut every single person out. I kept losing weight and had no appetite. I had the full support of my husband from day one and my best friend, but I still felt extremely alone and like the world was closing in on me.
finally decided to take my pediatrician's advice and call the fertility doctor that she had recommended. Unlike the first doctor that I saw, the doctor recommended a full round of tests for not only me, but my husband as well. They confirmed that I had severe polycystic ovaries without most of the common side effects. My irregular periods had affected my ovulation, as well as the quality of the egg once I finally did ovulate. The bigger surprise came when we found out that my husband had an undetected childhood varicocele. An abnormal blood flow to his reproductive organs had affected his sperm. He would need surgery to hopefully correct it, but at the very least prevent further permanent future damage. I was shocked and devastated, but more so fearful, because now I realized that we must tell our families. My mind started to get to me. I started to wonder if the person I love and I know I'm supposed to be with has an issue. Are we really meant for each other? But his constant support and calmness to take on whatever came our way together held me up. After my husband's surgery, the doctor advised us that there was no guarantee at his age to correct the damage, and with our combined issues, our normal time to conceive could be up to 2 to 3 years. We decided to start the IVF process right away. That's when the shots and pills and shots and pills and blood tests and more shots and more tests and early morning visits and late results and more pills and tears and anxiety started and really never ended. We were finally ready for our first retrieval. I had to go under anesthesia for the first time in my life and was extremely nervous. But when we woke up, we got great news regarding my egg count. Within a few weeks, we did our first transfer and waited for the results. Thank God a few days later, the doctor called to tell us the great news. It was a success. We were pregnant. It didn't feel real. We were on such a high and so grateful that our prayers had finally been answered. From there, I had to take blood tests twice a week to make sure the pregnancy was growing properly. The numbers were supposed to double with each blood test, and we eagerly awaited each result. By the beginning of the first week, the numbers had stalled, and the doctor suggested it might be an unhealthy pregnancy. We waited a few more days till the next blood test, and then the doctor confirmed it was an ectopic pregnancy. The embryo did not implant in my uterus where it is supposed to be. Rather, it was stuck in my tubes, which could be extremely dangerous if not terminated immediately. Luckily, it was caught very, very early. The doctors gave me a few shots, and within a matter of days, we were back to square one. From the highest of highs, we were knocked down back to where we started, only this time we had a taste of the other side. I want to pause and say that I know there are no coincidences in life. Looking back, I know that Hashem was with me through every step of the way, even though I didn't know it or feel it. I'm telling you this now because at the same time that I was struggling with infertility and having to deal with an ectopic pregnancy, I was diagnosed with melanoma, which is the most dangerous form of skin cancer, all within 6 weeks of each other. I had been so wrapped up in our loss that the severity of being diagnosed with melanoma at age 23 did not resonate. I couldn't imagine what else would have been thrown my way. I can honestly say that at that moment, I finally decided to stop being angry and asking why me, and started to accept all of these challenges. And that's really when things started to take a turn for the better. I'm sharing this part of the story with you because had the first pregnancy not been an ectopic, I would have been pregnant during the melanoma. My doctor informed me that pregnancy causes melanoma to spread much faster than it would have normally. The ectopic pregnancy saved my life. A month later, I was pregnant with my twins, and thank God this December they will be 14. We went through the IVF process 3 more times from there, and gratefully 2 were successful. Finally, with 4 little children at home, my husband and I were more settled and confident to let nature take its course, however long it would take to continue in order to continue growing our family. Around the time my youngest was about a year and a half old, it occurred to me that it had been 7 weeks since my period. A very dear family member was suddenly very ill, and I knew I had to see the doctor, but I just couldn't get there. Unfortunately, I ended up in the emergency room that week. It was another ectopic pregnancy with extreme internal bleeding. Was this a joke? I didn't know what to think. Congratulations, you can conceive, but it's not gonna live. Ironically, I never had to have surgery to remove my tubes, which is extremely rare given the two ectopic pregnancies. Hashem spared me and was watching me throughout, telling me that the odds don't apply when it comes to him. That was a turning point for me. Given my history, I truly had to accept that I could no longer conceive naturally, as it could put me in severe danger. I don't know how, but a very short time after that, we were ready to go back to my fertility doctor, and Baruch Hashem had my 5th child and 4th successful IVF transfer. Looking back, once my twins were born, I was able to fully accept this path Hashem had put me on. I was able to see the end results, and I really happily surrendered to whatever it took in order to have my family. The one that I always knew I wanted to have. So yes, I may have never experienced any late period excitement, like most women know. And every time we wanted to have more children, my husband and I had to coordinate our schedules and calendars and literally make an appointment to conceive. But I wouldn't change any of it for the world.
Thank you, Louisa. This is really such an incredible story. I mean, hearing that you had 3 life-threatening conditions. An ectopic pregnancy in and of itself can be life-threatening. And to have that kind of coinciding with melanoma, as you mentioned, which is also extremely life-threatening, is something that's truly beyond what anybody should know of. Did you feel that having these kind of outside stressors, outside of what was going on with your fertility issues, kind of changed the way that you viewed things, or how did it influence your journey at all?
I really put my mind, once I had the twins, I put my mind just accepting this,
What would happen?
whatever came my way. It was ironic because I'm normally extremely high-strung and anxious, but I accepted this path, I accepted the process, and I didn't expect to get so overwhelmed emotionally because we didn't even, every time we were ready to have more children, we said, this is what we're going to do, and it is what it is. And it really worked. It worked for us. It helped, but it put everything into perspective.
Great. Thank you. Okay. So our next panelist is Susie Nagar.
There aren't enough words to explain the first 7 years of my journey. I never thought I would be the first of my friends to get married and the last one to have a baby. I got married at 18 and we were ready to start a family right away, but life doesn't always work as you plan. Every year my husband would ask me, "So, what do you want for your anniversary?" Then my birthday came along and he asked me the same question. I always said a baby. My childless state was emphasized by so many experiences. There was a distance between my sister-in-laws and me. They had baby after baby, and I didn't. I was a girl that nobody wanted to tell they were pregnant. My friends and family were there to comfort me, but I found it difficult to confide in them because I felt like they would have a hard time understanding and they would be sad. It was so awkward even sitting around the dinner table with my friends when the conversation was all about their children. I was so happy for them, but it didn't change the fact that we were childless. I felt so isolated and alone. I had no one and nowhere to turn to. There were endless times when I felt uncomfortable, embarrassed, and hopeless. People would ask me how long I was married for and when I was going to have a baby. Weeks before my brother's wedding, I kept thinking about the photographer asking which kids were mine. The answer would be none. My husband once came home depressed, saying that his camper from 15 years ago was already having children. How are these little kids having children before us? We felt like we were on an island all alone. The hardest part was watching my husband suffer in agony because he couldn't give me the one thing I wanted most. How are you supposed to react when someone tells you they got pregnant by mistake, or countless doctors telling you it's time to adopt? One time I was getting a pedicure, and the manicurist asked me when I was due. I said, I'm not pregnant. I wanted to crawl under a rock. She answered, sorry, I give you extra foot massage. 7 years we waited. What happens in 7 years? An infant becomes a 7-year-old, a 6-year-old becomes a bar mitzvah boy, a 10-year-old becomes a 17-year-old. People are born, people get married, people start families, people move away and move back. They start businesses, their kids grow older, everyone was moving forward with their lives, we stayed the same. Instead of paying tuition bills, we were paying hospital bills. At first, I couldn't handle the struggle. I was so jealous and in so much pain, I didn't know how to handle it. I was at a point where I would look at women who had miscarriages and think to myself, at least they know what it's like to be pregnant. At least they know they can get pregnant. My sister, who was my best friend, got married years after me. When I accidentally found out she was pregnant with her first baby, I couldn't control my tears, and my husband found me crying in agony on my bed. But I moved forward and I put on a fake smile until I was in the delivery room with her, and I treated my first nephew as my own. 1.5 years into trying to conceive, we discovered that my husband had a very low and unhealthy sperm count. There's a common misconception that it's always the girl's problem. Male infertility is more common than you think, and it's just much harder to talk about. When it's your own issue, you sometimes feel comfortable enough to discuss it with your family or friends. But once it becomes your husband's problem, you feel guilty telling someone else's secret. It then leaves couples feeling even more alone. Normal sperm counts are in the millions. His were in the single digits, and none were viable. We did multiple procedures to procure more sperm and multiple rounds of IVF. However, we were not able to fertilize any embryos. The anxiety I felt when waiting for the phone calls with the results was probably the worst part. In a way, waiting for the phone call was more torturous than possibly hearing them say no. Nothing was successful in New York. We were at a standstill, so we decided to go to Israel. For years, we flew back and forth, continuing our painful treatments. We lived there for 2 months, promising we wouldn't go back without good news. Right before our last and final treatment, we went to a sperm bank. I sat there with my arms crossed, knowing after all we've been through, Hashem wouldn't want us to give up. So we decided to give one last treatment a shot. We walked into the doctor's office with a suitcase filled with medicine, so lost and confused. We were emotionally, spiritually, and financially drained. It was a last-ditch effort before moving on to donation or adoption. The doctors in Israel had hope. They believed it would happen. I can't explain the feeling I had when the doctor cornered me in the hospital to tell me how much healthy sperm he found. The torment was over. When we got the phone call a few days later, the doctor told us we have 12 embryos, like the 12 Shvatim of Am Yisrael. When I finally found out I was pregnant, it was a moment of excitement, euphoria, and shock. It was a miracle. Hashem finally answered all our prayers and tears. I was not only pregnant, but I was pregnant with twins. The sound of the heartbeat, something we wished for so long, and it was our dream come true. At the first sonogram, they saw 2 sacs, but there was only 1 heartbeat. The doctor said he was 99% sure it was a vanishing twin. But again, Hashem had other plans. 2 weeks later, we heard the second heartbeat. 9 months later, I gave birth to twins, a boy and a girl. When I gave birth to my son, Avi, I couldn't believe he came out first. I always wanted to be Dion Haben. I cried for an hour straight in the delivery room, thanking Hashem for the miracles he gave us, a boy and a girl. 2 years later, we were blessed again with another princess. Trying for 7 years, I always truly believed that Hashem would give us children. It was not a matter of if, but a matter of when. I knew I would be the best mother, and the only reason why I have kids today is because that's what kept me going, Emunah. In the end, what helped me the most was making the best of our situation and training myself to be happy for everyone. I wanted everyone to be happy for me like I was for them. My advice to all the childless couples is to enjoy time with your husband, travel, go out, have fun, spoil yourselves. Hashem knows what he's doing. Hashem sees everything. Hashem wants to give you children. He sees your pain. He wants to receive your prayers. In the end, mine were answered with 3 beautiful children, and Bezrat Hashem, many more to come. Thank you.
Thank you so much, Susie. Male factor infertility is actually, as you mentioned earlier, it's a lot more common than people think, and it's the primary and only source of infertility in 15% of cases, but it's actually implicated in 40% of cases of infertility, which is a really, really substantial number. And as you mentioned, I do think that it's sort of a not discussed issue, but it does deserve that attention because it does have an impact on a couple in their relationship. A question for you, being that this was primarily a male factor issue, did you feel that sort of had an influence on your relationship with your husband or how he felt towards you, either confidence, masculinity, whatever?
Yes, of course. There were times where I would be mad at him because it was his problem, but not his fault. It wasn't in his hands. But I would be angry that it was the issue where we weren't having kids. And we worked on ourselves to get through it.
All right, thank you. So for our next panelist, Shirley Shalem.
Hi, everyone. Oh, it's that loud. So my name is Shirley Shalem. I've been married for 8 years, and infertility is something I have dealt with from the beginning. It is a topic not spoken about enough in our community, and I feel like so many girls, including myself, feel isolated and alone. I'm a little nervous to speak, but I believe sharing my story will help spread awareness, so here goes. A year after I was married, I was ready to have a baby, and I wasn't getting pregnant. So of course, I called my mother, and we went to the best fertility doctor that we could find. I started with Clomid, IUIs, injections, waking up at 5 a.m. to get blood draws every morning. Whoever has been through it knows the drill. After 3, 4, 5, 7 months of medications and trying, I wasn't getting pregnant. I remember the cycle of getting my hopes up and then disappointment over and over again. I carried around like an ashamed and embarrassed feeling. I didn't want to go out, and I avoided big family affairs. I even missed one of my closest friends' weddings. I would randomly burst into tears, and I was afraid I would just embarrass myself. I didn't know anyone else who had this issue and had no one to talk to. After a year of fertility treatments, it finally worked. And guess what? It was worth every second. And then I wanted the next kid. The second time around, it took me 2 years. I went through 2 cycles of IVF. I had 2 miscarriages. I did so many embryo transfers that just didn't work. It felt like it was taking forever. My kids are almost 5 years apart, and not on purpose. But this time around was different. I didn't let myself become that embarrassed, ashamed girl that I was the first time. First of all, I made a friend. I was sitting in the doctor's office in the waiting room one morning, and I saw someone I knew. She was going through the same things as I was. She reached out to me, and from then on, we would always check up on each other. Also, I was very open this time. If someone asked me how I was doing, I would tell them. Everything. Maybe too much info. Every time I got a negative pregnancy test, yes, I would be sad, but talking to whoever would listen somehow helped me cope. My husband was always there for me, but I made sure to include him this time. I invited him to all my appointments. Also, this time around, I was working full-time as a nurse in the hospital. This kept me busy, but also kept things in perspective. Every day, I took care of patients who had it way worse than me. The girl my age who was recently paralyzed after getting hit by a car, or the young girl who was dying from cancer. It helped me see that I had my problems, but everyone has their problems, and I would never trade my problems for anyone else's. After 2 years, I was finally pregnant and had a healthy baby boy. Afterwards, I did not go on birth control because I didn't think I could even get pregnant on my own. But when this baby was 6 months old, I got pregnant again naturally. I was shocked. But I also was so happy and excited to have another baby. I had an uneventful and healthy pregnancy. But when I was 7 months, my water suddenly broke, out of nowhere. I rushed to the hospital, and before I knew it, I had given birth to a very sick and premature baby in the NICU. He got an infection while I was pregnant, and the infection spread to his brain. He lived for 4 days. I got to hold him while he took his last breaths, and I said goodbye. The weeks that followed were very hard for me. Would I ever be normal again? Would my marriage be the same? I was trying to be grateful for the family I had. But at the same time, I mourned the family I thought I was supposed to have. I was supposed to have another baby. I still imagine what I would be doing right now if I had another one. How old would he be right now? There are still things that might trigger me and bring me back to those moments. For example, when my water broke, I was making chicken soup. For months, I could not bring myself to make chicken soup because it was too painful. But what helped me through it the most was therapy. Therapy helped me work through the trauma so that I could process what happened. So little things like chicken soup don't trigger me anymore. Although I'll never forget what happened, I learned through therapy that it's okay to be okay, and it's okay to move on. And therapy was so important to help work through how and what I was feeling. I'm still processing what happened, and I really have no idea how I will be affected in the future because every day is different. But because of therapy, I'm able to stand here today and talk about it. After my loss, so many girls that I knew reached out to me and to share what they went through. I knew all of these people, but I never knew what they had gone through. I could not believe how common this was. I felt like I was part of a community of people who I could call at any time, and they would know exactly what I was going through. I am very thankful to all the people who let me know they cared. I'm sharing my story today to raise awareness for something that is much more common than we think, and to let even one person know that no matter what they're going through, they're not alone. That's it.
Thank you so much, Shirley. Really, really incredible story. And you know, you kind of mentioned that when the first time you were going through things, how that felt very, very different than future times after you had already had your child. I'm just kind of curious as well, being a nurse and being in the medical profession, having that knowledge, and we always say knowledge is power. Did you actually feel like knowledge was power when you were first? I know that later on you kind of gained that perspective, but when you were going through the process for the first time, before you had your first child, did you feel like it was empowering, or was it adding stress and adding?
I think it definitely helped with like the injections and the medication. Like that was like a breeze for me. Like all that was like not an issue, which for someone else, it's like very overwhelming. So that was good. But sometimes it's not so good if like you know too much. But I would definitely say it's a positive thing, just to educate yourself about like the medical side and like, I don't know, and I sometimes I help people with their injections and I could see it's overwhelming. So.
And I appreciate that you mentioned also that you were open about going through therapy and the help that gave you, because hopefully one of the initiatives that'll be started through this program will be support groups and things like that. So hopefully that's something that can continue, and you really are a trailblazer in terms of the example we're setting. So next we're going to go to. So Esther Mizrahi.
Hi. Okay. My name is Esther Mizrahi, and I wanted to share a little bit about my journey with everybody today. So I got married a little bit young. I was 19 when I was engaged, and I was 20 when I was married. And I always had this plan for my life of how I thought it would go. Be married 2 years, spend time with my husband, travel, do all those things, and then when I'm ready, have a baby. So my whole life I never had regular periods, but my mom also never had regular periods, so we never thought it was a big deal. She never really had issues getting pregnant. And the day came, I woke up, I said, okay, time for a baby. I tried to get pregnant for only like 2 months, maybe 3, and I had such a gut feeling that something was wrong. I can't pinpoint it, I can't explain it, it was like a feeling. And when I tried to explain it to my friends and family, they didn't get it. And it's not their fault, because if you try to tell somebody you're trying to get pregnant for 2 months and you think something's wrong, no, relax, calm down, don't think about it too much, and it was the first time that me and my mom weren't really on the same page. We did everything together, but we just were like not on the same page there, because she never had her regular periods and she was fine. So why would there be an issue for me? So I got up, I went to the doctor by myself. I said, I have to follow my intuition. Let me go to the doctor and see what's going on. So after a few tests and blood work and sonograms and all those things, he confirmed what I kind of knew all along, was that I was not ovulating at all. Nothing was happening, and I had polycystic ovaries. So he put me on Clomid, which seems very mild to me. It's just a pill you take for a few days, and we tried that for a few months, and still nothing was happening. So at that point, he said, okay, it's time to think about more aggressive measures. Because the Clomid wasn't helping me ovulate and nothing was happening still, he said, I think I want you to give yourself injections every day and go do an IUI, which is where they take a sample of your husband's sperm, they wash it in the machine, and then they put it up a tube. So that's kind of when my family and friends woke up and said, okay, there must really be an underlying issue. That's when they finally realized that something wasn't right. So I got up, went to the doctor. I said, let me do this. I'm going to do what I have to do. And I remember the first time I was due to inject myself with medications. I almost injected myself with air. My husband almost had a heart attack, so it was very scary. But I did it. For 7 days, I gave myself injections. And on the 7th day, I gave, one in the morning, one at night. They sent me to the doctor with my husband. They took the sample. They washed it. They put it up. They said, go home, have lots of sex, try to boost your chances, just do what you got to do, and hopefully, you'll get pregnant. And I remember I was calling a rabbi's wife to ask her a question about Nida, because I had to dip and I wasn't sure about the timeline. And it wasn't her fault, but I'll just always remember, I said, I'm struggling, I'm trying to get pregnant, it's been hard. And she said, well, how long are you trying for? And I think at the time it was like 7 months. And I said, it's been 7 months. And she was like, oh, that's not long. So anyways, and she kept going. And my heart just dropped because I felt so insignificant. I felt like what I was going through meant nothing because it wasn't, so severe as what other people know of. And it wasn't going on for years. And I just felt so isolated. But thankfully, we did the IUI and I got pregnant with my son. And I wasn't really sure if I was going to share the story of my second baby, but I think I'm going to go for it anyways because it all rounds up together. About 1.5 years ago, I said, let me see what's going on with my health. Let me see if I have to do the IUI again. It's not a big deal, but let me just, I just want to be prepared. So I went to the doctor, back to the original, going every day, checking sonograms, blood work. And after 3 or 4 months of consistently checking, he said that I was not pregnant. That I was not ovulating again. So I went home to my husband. I was so upset. And he said, it's okay. At least we know that what we did worked. We'll do it again. It'll be fine. And I just said, okay, when we're ready, we're ready. And maybe a week later, I got pregnant. So that was amazing. And I was a little hesitant to share my story today because I didn't feel like it was such a crazy story, like it wasn't, as powerful as the stories we're hearing today. But I just wanted to share with everybody that you do not need to be experiencing a trauma to feel, significant. You don't need to have something huge going on. You need to be trying for 2 years to feel like, like you need support. I was so isolated, and just because I wasn't trying for that long, I felt like my journey was so insignificant. Nobody could understand. Nobody could feel bad for me because it wasn't, people that are trying for 2 years, 3 years, you're only trying for 7 months. 1 month, 2 months, however long you're trying, it's very hard. It's very isolating. And if my story or if I could personally help anybody, it would be the help that I wish I had at the time. And I know this is going to be an amazing organization. And yeah, that's it.
Thank you. So we've heard about PCOS, or polycystic ovary syndrome. Just for a little bit of context, that's a condition with abnormal ovulation. So the most common presenting symptom is irregular periods, and that's due to an abnormal, typically, ovulation or the absence of ovulation. And you need medication for that. Mm-hmm. One thing that, I think your story is very, very significant in that, the majority of people will try for a shorter amount of time, but you kind of were approaching people about this and felt invalidated, it seems, multiple times. But I think, especially nowadays, it's also kind of difficult from the other perspective, from say a doctor's perspective. We have people coming in with a lot of anxiety and a lot of stress and a lot of pressure, and people are Googling things and diagnosing themselves. But could you tell us a little bit more about how you felt or what your intuition was rather than what or did you apply some sort of thought or Google search to what was going on with you?
I was a major mess. I mean, I wasn't dealing with it well. That's why I'm so happy that this organization is here, because my mind was just all over the place. I don't even know, but I can't really I can't explain it in any other words that I just had a feeling.
Okay.
I mean, my mom, Alice Cheer Life Coaching, just posted on Instagram 2 days ago, your gut is your guardian angel. And it's so true. When you have a gut feeling, you just have to follow it, because there was no other reason why I felt it. I just, I felt it.
Okay. Thank you so much.
No problem.
All right. So next is Stephanie Levy.
Hi, my name is Stephanie Levy, and I'm 34 years old. I have 10-year-old twins and a 2-year-old daughter. Throughout the next few minutes, I will mainly focus on my journey through postpartum depression and anxiety. But first, I'd like to touch on my experience with infertility and PCOS. It's a long story that's been brewing since I was a teenager. When I was 17 years old, my period suddenly became irregular, and I was diagnosed with PCOS. Polycystic ovarian syndrome, which is a condition that leads to infertility due to an abnormality in ovulation. It leads to infertility. I was put on birth control immediately. Fast forward, about 23 years old, my husband and I were ready to have children. My sister Alexis, who also has PCOS and had a hard time conceiving, advised me to go straight to a specialist. The doctor took me off birth control, and after a few rounds of unsuccessful medications, he suggested we move forward with injections and IUI. Shortly after the IUI, I was rushed to the hospital with severe stomach cramps. Turns out I had an ovarian cyst that ruptured, but I found out that night I was 4 weeks pregnant with twins, and I felt extremely grateful despite the obstacle. I needed to be monitored by the reproductive endocrinologist to make sure the cysts were at bay during my pregnancy, and I did not have postpartum depression after my twins. Years later, 2014, I was a mom, a housewife, and just life in general came with its ups and downs, but we were finally ready to try for another baby. 1 month into trying, I found myself in another episode of excruciating stomach pain, but this time I was in Mexico with my friends on our 30th birthday celebration. I was rushed to a private hospital, and the doctors were convinced I was internally bleeding due to another ruptured cyst. I couldn't lift my head off the pillow, while my friends were on the phone with my husband, parents, and doctors in the States trying to make the right decisions. They wanted $20,000 to operate, as they claimed my situation was fatal. The whole night was very traumatic. As I felt the pain going through my body, I turned to Hashem and asked him to please save my life. I had twins at home, and they needed me as much as I needed them. The abdominal surgery was successful, thank God, and I was released after 3 days and able to leave Mexico after a week. My Manhattan doctors were impressed with the hospital in Mexico, and they said that the doctor in Mexico saved my life. My doctor put me back on birth control to control my cysts, and I wasn't allowed to try for another baby for 6 months. Honestly, I was just so happy to be alive, and I am also extremely exhausted and drained at this point in my life. Soon after, with the help of Hashem, I got pregnant on my first try on our own. It was an easy pregnancy till about 4 months when I was diagnosed with symphysis pubis dysfunction. This made walking, standing, and sitting very painful at all times, but I registered all my thoughts and kept reminding myself to be grateful and thankful. I kept this positive reinforcement with me through the rest of my pregnancy and labor, and God blessed me with a beautiful baby girl. I was ecstatic. I was blown away. My emotions of happiness were through the roof, and then I crashed. I spent my days full of tears, constantly crying without knowing why. I had everything to be grateful for, but something felt wrong. The littlest things would set me off. I definitely went through some changes and traumas in my life that were overwhelming, but I didn't feel like it was normal to be as sad and overwhelmed as I was. I could not get out of bed. I could not eat. All I wanted to do was sleep, yet I couldn't sleep. My head was spinning. I felt ashamed. I felt guilty. I felt like I was in a dark hole. I had everything a girl could dream of: a loving family, 3 healthy kids, a beautiful new home on its way. The shame and confusion were eating at me. I was completely debilitated. Going to the bathroom was even a challenge for me. The smallest of tasks I could not get done. Making dinner was not even an option. A friend suggested that I call Yad Rachel, an amazing organization in Lakewood that helps women and their families suffering from postpartum depression and anxiety. I was scared of my own shadow and could most definitely not get behind the wheel of a car. My mother-in-law had to drive me there. Yad Rachel recommended I go to the Motherhood Center in Manhattan. The Motherhood Center was truly a source of hope for me. They put me on a 2-week program, 6 hours a day. Some days I left my baby home, and some days she came with me. It was not easy. My mom had to drive me there, and I had to rely on many people to help with a lot of different things at home. Going from independence to reliance was the hardest part. I wanted to get better the fastest way possible, and I wanted to do whatever it would take. I was still grateful to God and knew I had to do my part. That kept me going. Every day I got better, but extremely slowly. I had to remind myself daily that any progress is good progress. If it was one small task a day, then that's what it was, and it was okay, and I had to be gentle on myself. After the 2 weeks, I was nowhere near as done. I continued seeing a therapist and psychiatrist who helped me gain the power to take control over my life. I recently started to attend SBH postpartum depression and anxiety meetings, and they're extremely helpful. Postpartum depression hit me hard and fast. It's 2 years later, and I finally feel like Stephanie's back. I'm very proud to have gotten here. I continue therapy today because it helps me with all areas of my life, not only postpartum depression. I thank my husband, my family, and my friends for being patient with me because the healing process was long and distancing. So thank you for sticking around. It was important for me to open up and accept the help. The one main thing I learned throughout my journey is that I deserve to feel better. Everybody does. And God helps us when we help ourselves.
Thank you, Stephanie, for sharing that. That was really, really very moving. Postpartum depression is something that many people don't speak about, but it actually is quite common also. Postpartum blues, or kind of feeling down after pregnancy, I think is nearly universal. But it's important also to recognize that if you're feeling the way you were feeling, more than several weeks out, that it's appropriate to seek out help or to seek support. And it's very, very important that, it's critical that you have that done for yourself. I'm just curious, did you feel that any of your prior experiences with cyst ruptures and PCOS, et cetera, contributed at all to what you experienced?
Now that I think about it, yes, but I couldn't even see that 2 years ago. It wasn't clear to me.
Right. PCOS actually is independently associated with depression and anxiety, and so it's just something that everyone should be aware of as well, being that PCOS is so common as we see here, and I'm sure plenty of people in the room as well. So having that sort of heightened awareness, I think, is an important thing going forward. But thank you.
Thank you.
All right. And then thank you so much to all the panelists so far. I mean, I think one thing that we're consistently hearing is that, they all at some point had to help themselves or only be able to confide within, a small groups of people or close family. So it's very exciting that we as a community now are stepping forward and acknowledging this and recognizing this and kind of breaking down the walls and barriers and the stigmas associated with all these things. And hopefully the strength that they all show by being here and getting up will help, the next generation and more people. So we're going to do some questions now. And some of these will be directed at specific people and some for anybody on the panel to take. So the first question is, what advice do you have for parents and family to help support the couple that's going through infertility? And it's open to anybody.
Just to listen.
Sorry. Say it again.
Just to listen.
Okay. Next question is, what were the positives that came out of yourself after your experience?
That's a good question.
Yeah.
The perspective, really just, get a broad range
You speak into the...
to get a broad range of, what really matters matters, and to let go of, thinking you're invincible, really bringing yourself back down to earth, that it's really not in your hands.
It's
Just to relinquish.
like humbling.
Yeah, a very humbling experience, extremely.
Anybody else?
I have one more. That you never know what somebody's going through. You never know.
What is your advice for when the husband is the one with fertility issues?
It's very, very hard. It's difficult for the men because they want to feel masculine, and it's mortification for them, and to just build them up and say it's not your fault, everything's in Hashem's hands and the right time, and Hashem knows what he's doing.
Next question is for Louisa. What were your signs and symptoms of the ectopic pregnancy?
So the first one, I was very, very lucky because I was being very, very closely monitored because it was an IVF pregnancy. Like I said, the blood tests were monitoring everything on a twice a week basis. So monitoring the bloods closely, it didn't allow it to become dangerous. The second time around was very, very, very traumatic. I was late for my period, and then I thought I did get my period, but a day or two later, something was wrong. I knew something was wrong. Something was off. Similar to what Esther said, I knew something was wrong, and being that we were dealing with a very suddenly ill family member, I specifically remember, telling my husband, I can't get to the doctor before Thursday. And he was so worried. He's like, is everything okay? Did you get your, he knew with me that something was wrong. And I went into the shower, came out of the shower, and just fell to the floor. And it was unbearable, excruciating pain, like out-of-body kind of experience. Miraculously, I don't know how, it just stopped, almost unheard of, to the point where when I finally, my doctor met me in the hospital, he was scared to let me go because he saw what I was experiencing, and then all of a sudden everything had subsided. He is Jewish, and because it was a small amount of time and all he saw was internal bleeding, he wouldn't allow me to relinquish the pregnancy until he took a scrape to confirm that it wasn't in my uterus. So he promised me that night that I would call him if anything changed. It was miraculous. There was no pain anymore. And then he called me the next morning and he said, you are very pregnant. It's very dangerous. You must, treat this immediately. And it took a while for the pregnancy to completely dissipate because of how far along I was, but it never ruptured. I never needed surgery. It was really a miracle.
So it seems the second time around there was a bit more of a question mark about
Yeah.
it, about the diagnosis.
Yeah.
I would say that anytime you're pregnant, if you have a positive pregnancy test at home and you're having significant abdominal pain beyond what you expect for a normal menstrual period,
No, this was unheard of.
That
This
should
is-
prompt being evaluated up until just to determine where the location of the pregnancy is. We want to know if it's in the uterus or outside the uterus, because again, it could be life-threatening. And once you determine where it is, then
Yeah, the
pain
doctor
is-
takes control.
Exactly. Okay. This is for anyone on the panel. When you finally were pregnant, did you have a constant fear of something bad happening?
Every day. Every single day until delivery. Yes. Yeah.
Yeah.
For me, no, I knew it was it, and I was going to have children.
Same with me. Just let it go.
Thank God.
Just let it go, which is not my nature at all. But I just never turned back.
So it's sort of a mixed response. That's good. All right. This question's for Robbie. Okay, so it seems a lot of people are having difficulty. Is it because we are so open, or is it happening more? What do you think is causing the increase in infertility? So there's several reasons. One is that, so the overall incidence of infertility in general population is about 15%, and that really hasn't changed much. What's changing in the general population is that people are delaying childbearing kind of more and more. People are getting married, more and more women are going to college, doing careers and things like that, and so when you reach a certain age, it becomes more and more difficult, and usually we say by about 35, your ovarian reserve starts to decline more rapidly. That's one aspect of it. Another is that there's a lot more awareness at large. So as opposed to our parents' generation where this wasn't really spoken about as much, but there also wasn't treatments like we have today. Nowadays, we have really a very wide variety of treatments, and so whereas in the past, if you couldn't get pregnant, there wasn't much that could be done, now there are so many options that people are seeking that out more. Plus, could there be some sort of environmental things? It's definitely possible, but I think it's just that we're diagnosing it more and we're treating it more now than we were able to in the past. All right. Next is for the panel. Did you have a very insensitive experience with a friend or family member? Insensitive experience.
I did. There were a lot of people that were saying, what's the hold up? What's the hold up? And then finally one day I just snapped and I was like, there is a hold up. There's a reason. It's not just me, thinking, so it's hard, very hard.
Anybody else?
I think life became insensitive altogether, not even intentionally, We bought a house and it had 1 million bedrooms in it, and we didn't want to tell people. I told my husband I won't move into this house if I can't fill it. And then I'd get comments, oh, how perfect. You moved from the city and straight into a big house with twins. And I wanted to tell them, if you only knew what it took to get here, Perspective is very, 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 very different once you're on the other side. Yeah. But I'm grateful because now in life, I being on both sides, I have a different outlook. I really...
I'll say from personal experience also that these things come up and people, may make comments or question things, and they don't, everyone has good intentions, I think, but you just don't know what's happening on the other side of things, and hopefully if people are kind of more open about it or feel more secure about sharing what they're going through, that hopefully can help that aspect of going through infertility.
You said that, Shirley. That was very smart. She mentioned that by the end, you said that you're willing to talk. You wouldn't hold back, and it really, you moved forward.
Right, nothing has to be a secret. There's no secrets. It's okay to talk and open up.
Next is for anyone on the panel. What helped you most get through this tough time?
For us, we really trained ourselves to be happy for everyone, and we knew it was our lot in life. We traveled all over the world. We were happy. We were not content, but we were whatever.
You allowed yourself to be happy.
Yeah.
For me, definitely therapy was the best thing ever, and I wish I went sooner. There's no reason why anyone shouldn't be in therapy. Really, everyone should be in therapy. Yeah.
Also, therapy was very helpful for me and still is today.
And so the last question, how does endometriosis affect infertility, and is there a cure? So I guess this is for me as well. So endometriosis is a sort of a chronic inflammatory condition where you have abnormal growth of tissue that should be within the uterus that starts to grow outside of that within the abdominal cavity. And because of the kind of state of chronic inflammation, it affects implantation of the pregnancy and can cause other complications. There is no cure for it. It can be managed surgically, where you can kind of remove all the endometriosis, but there is a treatment and if you're having pain due to endometriosis. There's different sorts of pain medications and and hormonal-based therapies. And if you're having infertility due to endometriosis, again, there are a lot of tools in our arsenal now that can help. And depending on your age and if you have endometriosis, it certainly will make it harder for you to conceive. And you may need to kind of be more aggressive when you do have endometriosis with pursuing treatment. I think that's all the questions that we have. So thank you again to the panelists.
I mean, thank you. Amazing. Thank you, Dr. Robbie Sian. Thank you all to all our panelists. Thank you to everybody who came here today. We'll try to get back to any questions that we haven't gotten to yet. We have all your questions. We'll be able to respond in the coming days. If you haven't already, please sign in. You get automatically entered to get a free package. So if you haven't done that yet, please do so on your way out. One thing I did not mention, but I would like to, we are also offering being able to connect you to nurses in the community who can give fertility injections and also answer some of your questions about what to expect about a diagnosis or a procedure that's coming up. Also, you notice we did not collect any money today. That was purposeful. But if anybody would like to support us financially with a donation, you could please reach out to me or to Charles. And lastly, I just want to say, in case it wasn't obvious yet, to please reach out for help. We're here. We want to help you. We're waiting for your call. And I remember at the time saying, I don't need help, I just need a baby. And the second I did reach out for help, it was such a burden lifted. And I just want to encourage you to sort of take that very sort of courageous step to say, it's okay to ask for help. Together we can withstand the worst by coming together to bring out the best in each other. Thank you all for being here.